Thank you, Dr. Kelly, for joining us today. Hoping that you could give me a little bit of background on yourself, where you're from, and why you do what you do.
Sure. Well, thanks very much for inviting me to speak with you today. I've been here at Buffalo for about 4.5 years. I used to work in New York City at Columbia University Medical Center and was recruited up here to lead the new joint pediatric blood and cancer disorder program between Roswell Park and Oshai Children's. It was really a fantastic opportunity to come up here and to kind of help these wonderful institutions, coordinate their resources in order to provide the best care, latest advances for our children with cancer in this community.
What are the age groups of the children in the program?
So we treat newborns, all the way typically to age 21 years. So as you can imagine, there's a whole lot of developmental stages that, that are impacted as children develop cancer that have to be really part of the care that we provide. So much of what we do as, pediatric cancer specialists is provide we're supporting the whole family, the child, parents, the siblings. It's a very stressful event for them to have to experience. And so besides, the care provided by doctors, nurses, we have child life specialists, social workers, psychologists, art therapists, so many other different support services to help them through this very difficult experience.
So what type of cancers do you see in that age range?
Sure. So, as pediatric oncologists, there's a lot of different types of cancer that we see. About a third of cancers are leukemias and lymphomas. So those are cancers of the blood and the lymph nodes. We also see about a quarter of our patients have brain tumors. And then the rest have a whole wide range of different cancers, from bone tumors like osteosarcoma, tumors of the adrenal glands and nervous tissue called neuroblastoma, kidney tumors called Wilms tumors. So it really requires extensive knowledge because the treatments, really do vary quite dramatically. One of the great things about the new joint program is that it has allowed our program to expand. So now our physicians really focus on dedicated areas. My expertise is in leukemia and lymphoma, so that's really what the patients I care for, and I'm able to really keep up with the latest advances. And so having, that level of expertise is really critical in order to make sure that we're providing the best care for our patients.
What type of research is the joint venture focusing in on right now? Anything new or?
Yeah, we have a lot of really exciting research going on, which again has been facilitated by the joint venture. One of the really exciting new treatments that we're offering is a new form of CAR T cells. CAR T are kind of engineered white blood cells. They're part of the immune defense system, and in the laboratory, they can train them to go after a particular target on a cancer cell. We have a new study that is going to be focusing on children with bone tumors, osteosarcoma. It's very difficult to treat at times, and this study is coming out of research that was done in Roswell Park laboratories. The therapy is going to be given jointly between Roswell and Children's. We're the first in the country to offer this service, so we're really excited to be able to leverage all the exciting innovation coming out of the research, particularly at Roswell Park, and bringing it to our youngest patients.
What are the challenges that you face with the research that you need to do?
The challenge is, of course, the funding. Particularly pediatric cancer, it just receives a lot less research funding compared to adult cancers. I think, unfortunately, on the good side, we've had a lot of advances in pediatric cancer, so that overall, over 80% of our patients are survivors. But that means there's still 20%, that aren't surviving. It also, the other challenge we have is a lot of our treatments have, awful side effects that leave children disabled as they grow older. So there's still, I think there's perception that, we've cured it, that childhood cancer is okay, but in reality, there's a need for a lot of new treatments. If you look at, new drugs that have been approved by the FDA, in the last 20 years, only a handful are specifically approved for pediatric cancer. So most of the time we're kind of left to sort of figure things out based on the experience in adults, and we know very well that children are not just little adults. Their bodies, their cancers are really quite different.
What gives you hope with the work that you do?
I'm incredible. It's a really exciting time right now in cancer treatment. I've been doing this for the last 25 years, and all we really had for so much of that time were just kind of standard chemotherapy, drugs, which, effective for some types. Acute lymphoblastic leukemia, the most common type we see, we're curing over 90% of those kids now. But they really are tough. They have a lot of side effects in the short term. They have side effects in the long term. And now, with all of our precision medicine, understanding some of these really detailed mutations and allowing us to start using targeted drugs, all of the immunotherapy advances. One of the most exciting cases, if you'll bear with me right now, is we, had an infant with a very aggressive type of leukemia. And using, this immune therapy, the CAR T cells, we were able to put her into remission, help her to go on to receive a bone marrow transplant, and now she's a year out from her transplant, and it's just phenomenal. This is, a success that we never had before. Plus, the other exciting thing is we didn't have to send her out of the area. Only 3-4 years ago, there were so many therapies that we couldn't deliver here because we didn't have the joint program. Many of our bone marrow transplant patients had to leave the area. So now we're able to take care of them right here, which is so much, less stressful for the families and does, result in much better outcomes than they would if they had to leave.
For someone that's unfamiliar with the joint venture between Oishei Children's and Roswell, could you describe how that works?
Sure. So with the opening of the new Oishei Children's Hospital at the end of 2017, Roswell and Kaleida Health came together and established a formal relationship to support the Pediatric Cancer and Blood Disorder Program. So with that, all of our inpatient care is delivered at Children's. We have a beautiful specialized unit on the top floor of the hospital with amazing views of the lake, and really just everything is state of the art there. Importantly, we have close proximity to other pediatric specific services like the intensive care unit and the operating rooms and other things that were not available at Roswell in the past. And then all of our outpatient care is given at Roswell Park in a beautiful new facility, that also is state of the art, and it allows us to see patients and administer chemotherapy and transfusions all in the same area with nurses that are specialized in pediatric oncology. So it's really become a more seamless program, where we work collaboratively, and this way we're able to take the best of both, the pediatric care from Children's and the cutting-edge cancer care from Roswell in order to provide the best for our patients.
New this year for 2020, the 11-day Power Play is supporting the collaboration between Roswell Park and Oishei Children's. Could you explain where the money or the funds will be going this year to support that program?
You guys are providing so much support to us, but some of the things that you're helping us with is some of our wellness initiatives. We have found that our patients really need so much support to help them, through that. So all of the kind of, counseling about appropriate lifestyle and ways that families can help support their children is supported. And then the other is with our bone marrow transplant program. As you can imagine, it requires a lot of education and training to be able to manage these very complex, potentially critically ill children. So, you're helping to support the training of our nurses so that they know exactly what to do at every moment when these patients are getting treated.
Because things are changing every day.
It's unbelievable, how much it's training, and there's our transplants too, we transplant, there's so many different types of transplants, and there's so many different complications that can happen. Again, we had a patient who again is just such a success, who had to unfortunately get a second transplant and had a lot of challenges with it, but due to the excellent care that he received at Children's and at Roswell, he's been home now for about 6 months and growing and doing well. So having that specialized care makes all the difference in helping to allow people to stay here, get the care they need, and hopefully get them back on their lives in the future.
So you're familiar with the 11-day power
Yes.
play and hockey players in our community who fundraise all year to play in the event. They also train physically. The organization as a whole has raised just over $5 million as of a couple days ago.
That is amazing.
For cancer causes in our community, with a majority coming to Roswell Park. Is there anything that you would like to say to any of the players or donors out there that support the 11-day?
Just really a wholehearted thanks. I have to say, one of the things that really impressed me moving from New York City, 4 years ago, was just the community support. It just really blew me away, and how supportive. So, I can't tell you how much I appreciate all of these hockey players come out. I know hockey people in Buffalo are really passionate about, and it's just such a great, way to be able to channel that passion, into providing support for such, critically needed services here in our community. So thank you all for what you do.
Well, thank you, Dr. Kelly, for everything that you do, and it was a pleasure talking to you today.
As same here. Thank you.
Thank you.